Hello everyone, welcome to Jessie's MedBio. In today's section, I am going to discuss about our nurse topic from the chapter that is nursing care of neonate. So, our topic is common neonatal disorders. So, I am going to explain about some neonatal disorders that is hyperbilirubinemia, hypothermia and hyperthermia. So first one is the hyperbilirubinemia, which means it is the yellowish discoloration of the skin and sclera caused by serum bilirubin levels above the normal range in a newborn, or it is an excessive concentration of bilirubin in the blood. So it is also known as neonatal jaundice, and another name is icterus neonatorum. So hyperbilirubinemia means what? Hyper means high. Bilirubinemia means what? Presence of bilirubin in the blood. So if the bilirubin level is high in the blood, at that time the jaundice will occur. How we can diagnose the jaundice means there will be yellowish discoloration present in the skin, sclera and in our nails. Then coming to the causes of neonatal hyperbilirubinemia means we can able to classify the causes into two, that is physiological causes and pathological causes. So physiological causes means there will be increased breakdown of fetal RBCs, and also there will be the presence of immature liver enzymes, and then coming to the increased intrahepatic circulation, which means it refers to the circulation of bile salts between the liver and the intestine. If the level of circulation increases means at that time also jaundice will occur. Then coming to the pathological causes. So the first one is Rh incompatibility, which means if the Rh negative mother is having the baby with the blood group of Rh positive. Then ABO incompatibility, which means if the mother's blood group is O and if the baby is having the AB or AB blood group. Then if the enzyme named G6PD is having any deficiency, then any type of birth trauma like cephalohematoma and all, then polycythemia, then sepsis, prematurity, congenital infection. If the baby is having any type of congenital abnormality, at that time also jaundice will occur. Then any type of liver diseases, then biliary atresia. Biliary atresia means the bile that get blocked. At that time the bile can't able to transmit from the liver to the intestine. That condition is known as biliary atresia. Then hypothyroidism. That is about the causes of neonatal hyperbilirubinemia. Then coming to the types of neonatal jaundice. So here we can able to see four types. So the first one is physiological jaundice, which means the jaundice will occur with after the 24 hours of the birth. That is known as physiological jaundice, and it will go to the peak level by 3 to 5 days in term babies, and usually it will be disappear by 7 to 10 days, and sometimes it may take up to 14 days, and it is a harmless jaundice only. Then second one is the pathological jaundice. This is the type of jaundice which will be present within first 24 hours after the childbirth. So here the bilirubin level will increases very fastly and it will be longer than we are expecting, and also it required an immediate treatment. Then coming to the breastfeeding jaundice, which means if the baby is not getting proper breast milk, or if the breast milk is insufficient, at that time the jaundice will occur, and also it may cause dehydration and the poor feeding. Then coming to the breast milk jaundice, it will start to begin after 5 to 7 days of the birth. Usually it is occurred by the presence of some substance in the breast milk, which will increases the bilirubin reabsorption. At that time this breast milk jaundice will occur. Normally the baby will be healthy only. Then coming to the risk factors, that is if the baby is premature, or if the baby is having low birth weight, or Rh or ABO incompatibility, or if the previous sibling is having jaundice, then cephalohematoma, then poor intake of breastfeeding, if the mother is having maternal diabetes, or if any sepsis is present. At that time also, the chances of acquiring the jaundice is high. Then coming to the clinical manifestations. Mainly, there will be yellowish discoloration of skin and sclera. Then the jaundice will start from the head and then progresses to the toe. Then poor feeding will be there. The baby will be very weak and tired. Weak cry will be there. All the time the baby will irritable and high pitched cry will be there. Then if infection is there, fever will present. Then hypotonia and hypertonia will be present. Then if it is very severe condition, seizure will come, and also the urine will be very dark color and the stool will be pale color only. That is the clinical manifestations of jaundice. Then for the assessment, we have to assess the history, the onset and duration of jaundice, and about the feeding pattern and the color of the urine and stool, and we have to do the physical examination. Then we have to observe the progression of jaundice, whether it is increasing or whether it is decreasing the level of bilirubin, and we have to measure the level also. Then what all are the investigation or what all are the diagnostic measures are? We have to assess the total and direct serum bilirubin, then blood group of mother and baby, then direct Coombs test. This is the one of the effective test for the jaundice. Then we have to take the CBC, reticulocyte count, and smear. We have to assess then GCPD screening, whether the enzyme is having deficiency or not, that we have to assess. Then we have to assess the liver function and also the thyroid function to identify any type of liver condition is present or if the baby is having hypothyroidism or not. For identifying that, we have to do the thyroid function test. That is about the investigation. Then coming to the medical management. The important treatment for the jaundice is the phototherapy. It is the first line treatment for jaundice and it will convert the bilirubin into a water soluble form and which can be secreted or excreted through the urine and stool only. Then while giving the phototherapy, the important things we should focus or we should take care that we should protect the baby's eyes and we have to expose maximum skin surface, and also we have to monitor the temperature and hydration properly. Then second one is the exchange transfusion, and it will done when the bilirubin is dangerously high or phototherapy fails. When we have to do the exchange transfusion means if the phototherapy treatment fails, at that time we should do the transfusion method. It will remove the bilirubin and the antibody coated RBCs. Then coming to the intravenous immunoglobulin, which will be used in some kind of hemolytic diseases which occurs due to the RH or ABO incompatibility. For that conditions we are giving the intravenous immunoglobulin. Then adequate feeding, proper feeding should be there. Per day 8 to 12 feed should be there, and if the dehydration is present means we have to start the IV fluids, and also we have to treat the another causes. If sepsis is there, we have to give antibiotics. Then coming to the nursing management. For the assessment, we have to monitor the skin and sclera for the yellowish discoloration, and we have to assess the pattern of feeding, their urine, stool and activity, and also we have to check the vital signs and the daily weight, and at a regular interval we have to monitor the bilirubin level whether it is going down or high. Then during the phototherapy time we have to verify the prescribed light intensity and the distance, and we have to remove all the clothings from the baby except the diaper, and we have to cover the eyes of the baby properly, and we have to reposition the baby every 2 hourly, and also we have to encourage the mother for the frequent breastfeeding, and we should monitor the temperature every 2 to 4 hours, and we have to monitor for the dehydration, and also we have to maintain and record the IO chart, and for the stool frequency also we have to observe the color and also the consistency. Then we have to assess the skin for any type of rashes or the burn, and we have to continue the bilirubin level monitoring also. While doing the exchange transfusion, we have to prepare the equipment and blood properly. We have to assess all the vital signs and make sure that everything is normal, and we have to assess for any type of bleeding or infection is present or any electrolyte is imbalanced or not, and also we have to check for the hypoglycemia. And while doing the exchange transfusion, we have to maintain an aseptic technique. And coming to the general nursing care, we have to provide proper warmth to the baby, and we have to improve the bonding between the mother and the baby, and we have to educate the parents about the jaundice and also about the treatment, and we have to encourage them for the exclusive breastfeeding. Then we have to check for excessive sleepiness, high-pitched cry, seizures or increasing jaundice. This is all about the hyperbilirubinemia. Then coming to our next condition, that is hypothermia. Neonatal hypothermia is defined as an axillary body temperature is below 36.5 degrees Celsius or below 97.7 degrees Fahrenheit. So if the temperature is below 36.5 degrees Celsius means at that time the hypothermia will occur. So we can classify the hypothermia into three, that is mild, moderate and severe. Mild is also known as cold stress. It is between the values of 36.0 to 36.4 degrees Celsius. Then coming to the moderate means it is from 32.0 to 35.9 degrees Celsius. Then coming to the severe means if the temperature is below 32.0 degrees Celsius means it is severe hypothermia. Then coming to the causes means if the baby is a premature, then if the baby is having low birth weight, and if the delivery room is very cold, and if we are delaying the drying of baby after the birth, and if we are bathing the baby soon after the birth, and inadequate clothing and wrapping, and while during the transportation time if we are exposing the baby unnecessarily, and if the baby is having any type of sepsis or infection, and if poor feeding is there, at all these times the chances of occurrence of hypothermia is very high. Then coming to the risk factors also, preterm infants, low birth weight babies, birth asphyxia, which means the baby can't able to breathe immediately after the birth. Then sepsis, and if the baby is having any type of congenital malformation, and if multiple birth is present, or if the baby is requiring prolonged time for the resuscitation. Then coming to the signs and symptoms, the baby's skin will be very cold, especially the hands and feet, and the temperature will be very low, and the baby will very sleepy and inactive at all the time, and poor feeding of weak suck will be there, weak cry will be there, and the baby is having apnea or slow breathing, and also respiratory distress will be present. The baby's heart rate is very low, and the baby's skin may turn to bluish color, and also hypoglycemia will be present. In severe cases and all, unconsciousness or shock will. So then we are moving on to the nursing management of neonatal hypothermia. For that, first we have to assess the baby. For assessing the baby, firstly we have to check the temperature regularly, and also we have to assess or monitor all the vital signs, and we have to observe for the signs of cold stress, and then warm the baby, which means if the baby is wet means we have to immediately dry the baby, and also we have to use warm blanket and cap for the baby, and we have to start the skin to skin contact to the kangaroo mother care for the stable babies, and if needed we can use the radiant warmer and the incubator, and to avoid the complications we have to warm the baby gradually. Then coming to maintain the warm environment, we have to keep the temperature of the room in between 26 to 28 degrees Celsius. We have to avoid unnecessary exposure of the baby, and warm all the linens and all the equipments before using. Then support the feeding. We have to encourage the mother for the early and the frequent breastfeeding. If the babies can't able to suck means we have to give the expressed breast milk through the cup or the feeding tube, and also we have to monitor for the hypoglycemia, which means if the breastfeeding is not giving properly, there is a chances of occurring hypoglycemia. Then we have to monitor continuously. We have to record the temperature every 30 minutes to 1 hour until the baby is becoming stable, and monitor the vital signs and also assess the urine output and the activity level of the baby. Then next one is the preventing infection. We should maintain the hand hygiene and also we should use the aseptic techniques, and also we should watch for the signs of infection. Then coming to administering the treatment. We have to give the oxygenation if they are prescribing, and also if they are prescribing means we have to administer the IV fluids, and also if the infection is present means we should give the antibiotics. Then coming to the next one is education of parents. We should teach the parents about the proper wrapping and clothing of the baby, and also about the kangaroo mother care, and tell them to avoid early bathing, and also we have to explain them about the danger signs of the hypothermia and advise them that when to seek the medical care. That is about the hypothermia. Then coming to the hyperthermia. Neonatal hypothermia is defined as an axillary body temperature is above 37.5 degrees Celsius. If the body temperature of the baby is above 37.5 degrees Celsius means it is termed as hyperthermia. We can classify the hypothermia also into three, that is mild, moderate, severe. Mild means if the temperature is between 37.5 to 38.0 degrees Celsius. Then moderate means if the temperature is between 38.1 to 39.0 degrees Celsius. And if the severe means if the temperature is above 39.0 degrees Celsius. For the causes, if the baby is overheated from the radiant warmer or the incubator, or the environmental temperature is high, and clothing and wrapping excessive, then dehydration, then infection, then maternal fever during the labor time, and if the baby is exposed for a prolonged time to the direct sunlight, and it may cause due to the certain type of medications. Then coming to the risk factors, if the baby is a preterm, and if the baby is having low birth weight, if dehydration is present, and if the baby is receiving the phototherapy, and baby is under radiant warmers or incubator, and also neonatal infection. In such conditions, the risk of occurrence of the hypothermia is high. Then coming to the signs and symptoms, first one is the body temperature will be above 37.5 degrees Celsius. The skin will be warm, hot or flushed all the time, and the baby will get irritable, and the baby will have restlessness, and poor feeding will be there, and the baby's heart rate will be high, and also the breathing will be high, and the baby will sweat. Then lethargy will be there, the urine output will be decreased, and if in severe cases seizure will be present. Then coming to the nursing management of neonatal hypothermia. For that, first we have to assess the baby. Like the previously only, we have to monitor the temperature, and should we have to assess all the vital signs, hydration status, urine output, and also we should check for the signs of infections. Then our main aim is to reduce the body temperature. For that, we have to remove the extra clothing. We should lower the room temperature, and we should adjust the incubator or the radiant warmer, and we should not use ice packs or cold water bath as they may cause rapid temperature changes. Then coming to maintain hydration. How we can maintain the hydration means we should encourage the parents to provide frequent breastfeeding, and if the babies can't able to suck means we should provide the express breast milk, and if needed administer the IV fluids. Then coming to next one, that is monitor closely. We should check the temperature every 30 to 60 minutes, and we should observe for the seizure, lethargy or the respiratory distress, and also we should maintain and record the IO chart. Then treat the underlying cause, which means if the fever is present means we should treat that, and also we should administer the antibiotics and correct the dehydration and the electrolyte imbalance in the baby. Then maintain infection control. For that, we have to maintain a proper hand hygiene. We should follow the aseptic techniques, and also we should monitor for the signs of neonatal sepsis. And then we should educate the parents, which means we have to dress the baby in a light and in an appropriate clothing. We should avoid the overheating and the exposure towards the direct sunlight, and we should ensure the adequate breastfeeding to prevent the dehydration, and also we should educate the parents to recognize the warning signs such as fever, poor feeding and the lethargy. These are the nursing management for the hyperthermia. So these are the main three disease conditions that we are discussed today, that is hyperbilirubinemia, hypothermia and hyperthermia.